Welcome to another Medical Monday. Continuing our respiratory theme, I wanted to go through, and I thought it might be helpful to just talk about the respiratory airway and some of the diseases associated with the respiratory airway. So a couple of things that you may have heard of are croup, bronchitis, RSV bronchiolitis, and pneumonia. When we give you a diagnosis like this, we're talking about very different things, and they relate to where they are in the airway. So when we have croup, we have a narrowing of the actual opening to the trachea at the vocal cord level, and we have swollen vocal cords, and so you hear a hoarseness in the voice and like a barky, croupy cough. When we have bronchitis, we have a very honky kind of sometimes smoker-like cough, can be very wet, but it also can be dry and brassy sounding, and that is in the larger airways, bronchi. The bronchi are these two large airways just coming off the trachea, so that's where bronchitis is sort of in the medium to larger sized airways. And then if your child has something like RSV or bronchiolitis caused by flu, we see that in the medium-sized airways, a lot of mucus and swelling there that makes it very difficult for them to get air down, all the way down into their lungs to the alveoli, these little small dots here. And the little small dots, when we have infection all the way down in the bottom of the airway, that's what we call pneumonia. Pneumonia has a very different sound than bronchiolitis and a very different sound than bronchitis or croup. And so this diagram of the sort of upside down tree of the respiratory airway is always been fascinating to me and very descriptive, these terms, in terms of where that disease is happening. I hope this is helpful for you in understanding a little bit more about what these diagnoses mean. Thank you for joining me for another episode of Medical Monday.